Hi, thanks for watching this video. Today we're going to be talking about foot drop after a surgery. So you can have foot drop after a hip surgery, a back surgery, or a knee surgery, for example. All of these things can, unfortunately, have complications. It's not exactly common. Trust me, the doctor doesn't want you to have these issues, but it can happen. So there, obviously, you know already before ever watching this video that there's nerves in your back, and that those nerves can go all the way down basically into your foot that innervate your dorsiflexors. In a sense, it's all one big line from your back down to your foot, although it's not always called the same thing. For example, your nerve roots, L4, L5, S1, S2, okay, they can be the beginning of the sciatic nerve. Okay, the sciatic nerve goes down the posterior compartment of your thigh, okay, and then around your knee level it bifurcates and goes down into the lower leg. So if you've had a surgery like a spine surgery or a hip surgery or a knee surgery, you know now, or maybe this is just a reminder for you, that it's all just part of the same line in a sense. And the surgery could have hit the nerve, compressed the nerve, injured the nerve somehow. And as a result, you know that even if it's from your lower back, the foot can be affected, or your hip or your knee, your foot can still be affected, okay? Now, sometimes with these kinds of things, it can come back on its own. I hope it does for you. I totally hope it does. Sometimes it's a wait and see thing. Don't wait and see too long. We've written a book on AFOs, foot drop, and fall prevention, and we have a character named John. And John is so used to giving things time that it becomes his default way of dealing with things, right? The back pain, the knee scrape, whatever it is, sometimes that becomes people's way of dealing with their pain or their health problem. But you can't always do that, especially as you get older. Okay, we're not always 20 years old anymore. So if you have foot drop, it could be from any one of those surgeries. So back, lower back, especially hip, knee issues, and just getting the nerves involved, getting those injured. Sometimes the injury can recover. That usually takes months, and up to, I think it is usually 18 months. But there's other things you can do about it. The physical therapy is great. Occupational therapy is great. You can see an orthotist, a person in my industry that helps with these walking aids. It really helps people walk better. If you've had one of those surgeries, it's not common. It's actually extremely low. And unfortunately, you may have that issue right now by watching this video. But know that there's things that can be done about it, and don't necessarily just go to a walking cane and call it a day. There's a lot more out there. So good luck to you. I hope that the foot drop goes away, but if it doesn't, do keep learning more. Learn more about AFOs if you can. Those are extremely great walking aids, but there are many different kinds, so it's going to behoove you to learn more about the different kinds, or at least coming into meetings with someone called an orthotist that can make this walking aid that goes directly to your foot drop issue, which is something that's a real good idea. You don't want to have your foot drop be the thing that trips you and makes you fall, okay? So good luck to you. Just know that it can be a side effect of these kinds of surgeries, but there are things you can do about it to help treat your foot drop. Thanks for watching.